Management, and Scott Bookman, the Incident Commander of CDPHE. And before we get started, I'll have them each say their name, title, and then spell their names for you.
I am Mike Willis, W-I-L-L-I-S. I'm the Director of the Office of Emergency Management.
And Scott Bookman, S-C-O-T-T-B-O-O-K-M-A-N, and Incident Commander for CDPHE.
Great, and we'll take questions until about 11:30. So I will go ahead and read them out, and if there's a duplicate question, I'll just acknowledge that it was submitted and move on to the next one so that we're able to get through as much as we can in 30 minutes. This first question is from Sam Tabachnik at the Denver Post. Over the weekend, Dr. Deborah Birx, the White House Coronavirus Response Coordinator, said she was worried about a potential new hotspots for one of the virus, naming Colorado as one of them. Does CDPHE agree with this sentiment from top federal officials? Why or why not?
This is Scott Bookman. We are continuing to evaluate the modeling. The initial information that we're seeing is that our social distancing efforts are working and that the stay-at-home order is being very effective. We are continuing to prepare for a surge of patients in case they arrive. We want to make sure that we are here to protect and care for all Coloradans, and we just want to continue to encourage people to stay home and maintain social distancing so that we can continue to prepare our healthcare system.
This next question is from Luke Runyon at KUNC. When will CDPHE have data on COVID-19 cases and deaths with more demographic information, like race and ethnicity broken down?
This is Scott Bookman. We are continuing to work with our Vital Records team and other members of the Public Health Department to better define this data. We know that there is a need for it, and we are working to develop it as rapidly as possible.
Matt Morrow with Fox 31 asked a similar question. Is CDPHE tracking COVID cases by race and ethnicity? Is African American community here being infected at a higher rate as many cities on the East Coast are experiencing? So we've just answered that one. Thank you, Matt. Taylor Summers from NBC News Radio asks, the Colorado Innovation Response Team has been testing PPE created by various independent companies and residents at Colorado State University Engineering Lab. Has anything from the lab come forward that can help address shortages healthcare workers face with items like N95 masks, face shields, and hospital gowns, etc.? If so, could you give any examples?
This is Mike Willis. I do continue to test for the viability of some of these innovative PPE. We haven't brought any of them to bear in the system yet, though.
This next question is from Megan Heiler at KKTV. We are hearing reports and even seeing signs sent by viewers about an employee testing positive for COVID-19 at a Costco off Powers in Colorado Springs. Do you know anything about this? Is this dangerous for the public who shop there? Can they get sick?
This is Scott Bookman. I am not aware of that individual case. We want to just encourage everyone who has any signs or symptoms of COVID-19 to stay at home and contact their healthcare provider.
This question is from Denver 7. With Routt County now counting probable cases within their positive case count, are you seeing other counties do the same? And are there concerns the practice may inadvertently inflate the number of positive cases?
This is Scott Bookman. Every county is making their own choices. We are looking at the bigger trends across the entire state as we try to understand the movement of this illness across our state and the trajectory of it.
Mark Craddock with the World Journal newspaper asks, at the Monday press conference, CDPHE Chief Medical Officer Eric France said that because of PPE shortages, we will be enacting crisis standards of care, particularly for personal protective equipment, PPE, in the coming days. Has that occurred yet? Do you anticipate it anytime soon?
This is Scott Bookman. Yes, we enacted the crisis standards of care for EMS and for PPE earlier this week.
Ben Marcus with CPR News asks, what is the granddaddy metric for guiding policy on coronavirus? Deaths are likely undercounted. Case numbers are dependent on testing, which is limited and inconsistent. Would hospitalizations be a better metric? And would you look at a week's worth of data versus noisy day to day?
I think it's Mike Willis. I don't think there is a single granddaddy metric. I don't think that's an appropriate way to look at it. You have to look across a broad spectrum of metrics and aggregate them in together to get an understanding of the trends in the state.
I want to acknowledge that we've received another question from Blair Miller at Denver 7 about demographics, like racial demographics and data. So thank you for that question, Blair. Luke Runyon at KUNC asks, we've seen outbreaks in meatpacking facilities which are deemed essential. Are there any plans at the state level to enforce social distancing within those facilities or aid local public health departments in keeping these plants from causing new outbreaks while staying operational?
Mike Willis. We're in close contact with local health and emergency management officials in the affected counties, and I think it's too early to comment on actions that will be taken. But definitely, the state and local officials are in close contact with the facilities and looking at solutions to protect that piece of critical infrastructure.
This next question is from Jensen Worley at the Denver Business Journal. Can you please give an update on the Innovation Response Team and if they have any solutions they can share at this time?
Mike Willis, the Innovation Response Team continues to pursue a variety of solutions and opportunities. It's important to remember that most of their work will be brought to bear. They're looking into the future more so than the immediate. They have some really strong leads on sterilization equipment, and I think we'll see some of their efforts come to bear soon.
Blair Miller with Denver 7 asks, can you speak any more to the plan to have refrigeration trucks at sites or any more specifics about these new sites that are being stood up?
The state has acquired refrigeration containerized units. Currently, there is not a specific need anywhere, so they're being held in reserve, stored until such time as a need arises.
Taylor Summers with NBC News Radio asks, hospitals in other states have discussed using methods like UV sterilization and aerosolized hydrogen peroxide to decontaminate PPE items that are exposed to COVID-19 patients so that they can be used several times. Are those methods under consideration by hospitals in Colorado? If so, is it something that can be done at a large scale?
Mike Willis, yes, those types of sterilization methods are under consideration, as well as some other ones. We've asked the federal government to provide a sterilization machine. Actually asked for two, produced by Patel, that would potentially sterilize up to 100,000 N95 masks per day. So yes, absolutely, we are pursuing opportunities to sterilize PPE and reuse it.
This question is from Chris Vanderveen at 9 News. With the news that a member of the CDPHE leadership team has tested positive for COVID, have any other members of the leadership or response team been tested, including Governor Polis? How many members have gone into self-quarantine? Which ones?
That's Mike Willis. Yes, we did have a member test positive for COVID-19. That was not unanticipated. We're all humans too here, and so we have plans in place to continue to work, and I think we wish him a speedy recovery and appreciate the question.
Jensen Worley with the Denver Business Journal asks, what will the build-out of the temporary hospital spaces in the state's building look like? What will the Army Corps of Engineers do in the next few weeks to get them up and running in time?
It's Mike Willis. Yeah. Actually, the alternate care sites will come in a variety of different capacities and capabilities, and the Corps is working very hard right now on two facilities right now: the the Colorado Convention Center and the ranch up in Loveland, to bring those to bear in time to decompress our hospital system. It's really important to remember to keep reminding the public, once these are open, people should not go to these first. They should go to their provider or their regular hospital first. These sites are specifically designed to decompress the hospital system, and so they won't accept walk-in patients directly to the site. People need to remember that and go to their standing hospitals.
This next question is from Jean Devant at the Colorado Springs Business Journal. What are the implications for Colorado of FEMA's ending funding for community testing sites?
It's Mike Willis. A couple of things. One, I think that program is going to be extended, and if that particular program does sunset, it'll be replaced by a different method. Testing is very important to the state of Colorado, and we're pursuing a number of avenues with federal support to continue to be able to test. All of those programs are constrained by the constrained supply system, but we are getting federal support for continued testing.
Libby Smith with CBS 4 asks, can you tell us what counties the nursing home outbreaks are in? Libby, for that one, I'll have you email the media info for more information on that. John Herrick at the Colorado Independent asks another question about the race and ethnicity data, so I think we've already addressed that today. Thank you for that. Ellis Arnold with Colorado Community Media says, some criticism of public health modeling of the COVID-19 spread has been written, arguing that some of the modeling conceals a true peak by not using a wide enough time frame, and also that the peak number of cases will be the same with or without social distancing as long as there is not a vaccine. Does Colorado modeling assume the peak number of cases decreases with social distancing because the model assumes mass testing and more accurate isolation and contact tracing will be successful?
This is Scott Bookman. We are continuing to update the models that we look at and utilize as we plan for the future. We know that as we relax some of the social distancing as we move forward, it will require a great deal of testing and contact monitoring and isolation orders to ensure that we can keep everybody safe.
Chris Vanderveen asks, testing numbers in Colorado appear to have once again stalled. What would explain that? This includes state lab and private lab.
Chris, this is Scott Bookman. I think the real challenge here continues to be the availability of specimen collection kits. While there is now an enormous amount of lab testing capacity, both at the state lab, at our hospitals, and in the private sector, there's still a great deal of challenge due to a lack of PPE and a lack of viral transport media and a lack of sterile swabs to actually collect the specimens for testing.
Libby Smith with CBS 4 asks, does Colorado currently have enough ventilators? When do you anticipate will run out?
This is Scott Bookman. At this point, we have an excess of ventilators in the state. We are still preparing to bring more ventilators in through every avenue that we can. We continue to expect to see a surge of patients over the coming weeks, and we need to make sure that our healthcare system is prepared for that.
Lily Tyson with KUNC asks, based on the compliance from the state's stay-at-home order, when is the state projecting the peak number of cases will be?
We are now, Scott Bookman, so the updated information really leads us to believe that we have pushed the peak into May at least, at this point. We're still trying to gather more accurate information to understand exactly when it'll happen, but the social distancing has worked, and we have pushed that curve to the right as we hoped to.
Blair Miller with Denver 7. We have cases in Powers and Gilpin counties now, which would mean 56 counties. Are there any counties that have not reported to you, or should we believe that there are 8 counties that have no cases?
This is Scott Bookman. Everybody is following the rules and reporting as they are supposed to. We do believe it's likely that there are cases in every county, as we do believe that there is an undercounting of cases across the state. It just means that we don't have laboratory confirmation of those cases at this time.
Libby Smith with CBS 4. Can you give us a better estimate of the number of people in the state who actually have the virus?
This is Scott Bookman. Again, we think that we have underrepresented the number of cases by somewhere between 4 and 10 times based on a lack of ability to collect specimens and test them.
This next question is from Jesse Paul at the Colorado Sun. Since Colorado is now only testing such a limited pool of people, how can the state really know where we are at in terms of infections?
So this is Scott Bookman. We do acknowledge that the limitations in testing provide us with a lack of true clarity on what is happening. But again, we're always looking at the trends to understand what direction things are heading, looking at total case counts, looking at the number of deaths that are reported, looking at hospitalizations, and we really look for the trends more than the individual numbers.
Jim Anderson with the Associated Press. With the national PPE stockpile depleted, what new strategies is Colorado pursuing to get PPEs and ventilators we need? Are we forming consortiums with other states to increase purchasing power?
This is Mike Willis. There are a number of avenues, both through the private sector and through government sector, to pursue PPE. We are working in concert with some other states, and also at the same time working with FEMA to explore all avenues of acquiring PPE.
These next questions are from Ellis Arnold at Colorado Community Media. He first asked about race and ethnicity data, which we've already discussed today. But then he also asks, assuming the stay-at-home order ends on April 26th, how long does CDPHE expect other social distancing measures to last, such as the closures of restaurants, bars, schools, restrictions on gatherings of 10 people or less? Would it be weeks, months, etc.?
Yeah,
This is Scott Bookman.
Oh, go ahead, Scott.
That's okay. We're continuing to evaluate the right policy decisions, working on advising the governor on the best path forward. We do understand that until there is an effective treatment or vaccine, that COVID-19 will be with us, and we're going to have to respond accordingly.
Ellis also asks, does the state expect such social distancing measures to be necessary until a vaccine is found?
Mike Willis.
Go ahead, Mike.
I think that it's important for the public to understand that some social distancing measures will be necessary as we come out of the first wave. We'll still need to change some of our habits, and of course we'll look for voluntary compliance and encourage all of us to help particularly protect our vulnerable populations. Folks over 60. I think that whether we do it in some sort of official policy guidance, or we just continue to ask people to behave differently than they did before COVID-19 came to our state, you can expect to be encouraged to continue social distancing for the foreseeable future.
Chris Vanderveen says, sorry, must ask a follow-up. Have other members of leadership team been tested, including Governor Polis, and is anyone self-quarantining now? Who?
I think I appreciate that you asked that twice. It's important to know that we were well prepared for for this eventuality, and that while there are members of the Emergency Operations Center staff that are self-quarantined, we continue to operate and fully function.
John Herrick asks, have there been any confirmed COVID-19 cases in any of Colorado's halfway houses? And he is with the Colorado Independent.
This is Scott Bookman. That's a really interesting question. We'll need to look into the data to see if we know that.
Lucy Haggard asks, Boulder County joined the Forest Service today in instituting level 1 fire restrictions, citing the need to reduce the burden on emergency services. There have also been a few rescue situations recently that have resulted from people overestimating their ability to navigate the outdoors. Are there any plans to limit or otherwise monitor outdoor recreation on a statewide level? Choose with KGNU.
This is Mike Willis. Typically, fire bans are instituted at the county level. They're not uncommon in the state of Colorado. County sheriffs frequently do that, and about this time of year, every year. And we also frequently encounter people in our state that, or people who have come to our state that overexert themselves, underestimate the effects of altitude or their own abilities. Those are just annual common things that we go through every year. I don't know that we'll pursue necessarily a statewide fire ban. The sheriffs tend to have a really good finger on the pulse of their own response capability and take those measures at the county level. The governor does have the authority to do that, but typically the counties understand their own circumstances well enough or better than the state.
Lily Tyson with KUNC asks, does the state agree with the guidance from CDC about when workers who have been exposed to COVID-19 should return to work?
This is Scott Bookman. That is new guidance, and we are continuing to evaluate it to see how we best meet the needs of the state. Obviously, as there's more COVID-19 in our communities, we need to ensure that frontline healthcare workers, critical infrastructure have the ability to be in the workforce, even if they have been exposed and aren't symptomatic.
Jesse Paul with the Colorado Sun asks, how can you know the trends if the testing is lagging? If you don't have an accurate view of the infection situation, how can you know the trend?
This is Scott Bookman. We know that our hospitals are doing an enormous amount of testing on patients that they have in their facilities. That information alone gives us an understanding of the trends in our hospitals. We do all recognize that there is a lack of testing across the entire country. We need more testing to understand what is truly happening out there, but certainly the hospitalization data gives us a clear picture of what's happening.
Brian Ulmer with Barn Media asks, or of the Barn, has CDPHE sent out any specific orders or guidance to senior living centers, independent living, assisted, or full care facilities, or are they on their own to issue lockdown or other procedures?
Mike.
Go ahead, Mike.
Oh, this is Mike Willis. Yes, CDPHE did issue a public health order providing guidance to long-term care facilities.
Jim Anderson with the Associated Press asks, do we know how much the state has spent to acquire PPE, ventilators, and essential equipment?
It's Mike Willis. Yes, we've roughly obligated a little over $50 million, much of which will be reimbursable through the Stafford Act and FEMA, as well as CDC grants.
Lucy Haggard with KGNU. There's been discussion comparing COVID-19 to the 1918 Spanish flu, with the second wave hitting as the autumn of that year rolled around. You mentioned a first wave. Do we anticipate more waves, and what would cause that? Or is there a way to prevent that?
This is Scott Bookman. We do know that until there is a vaccine, that we will continue to see COVID-19 circulating in our communities. As social distancing and stay-at-home orders are loosened, We do believe that we will see an increase in patients. It's our job to make sure that our healthcare systems are prepared for any potential surge, and that we have the tools in place to do testing and contact monitoring and isolation as needed.
This question is from Jesus Carrasquel with Univision News. According to the governor's order to stay home, does the police have the authority to detain people in their cars and ask for documentation or permission to stay on the street?
This is Mike Willis. You know, the governor's frequently emphasized, and so I'll just reemphasize, that this is really about doing the right thing and voluntary compliance. It's really important that the public understand that they should not be putting other people at risk or putting themselves at risk. It's just the right thing to do. Law enforcement is not pulling people over or doing random traffic control points to check for documentation. But people really do need to stay at home and do the right thing.
Brian Almer of The Barn had a follow-up question to the procedures that were issued to assisted living or full care facilities. He just asked for a follow-up. Brian, do you want to perhaps email our media email, and maybe we can help you answer that question? Lucy Haggard with KGNU, following up to a previous question, is there a way to somehow snuff out the virus by extending stay-at-home orders or social distancing measures so that the transmission chain gets eliminated 100% and there's no second wave?
This is Scott Bookman. You know, we're really looking to other countries where this struck first to understand how things will evolve over time. As many of you are aware, Wuhan, China has started to release their stay-at-home orders, and we're going to watch very closely to understand what happens there and in other countries as well.
When does the state expect to receive the 100 ventilators that Trump said he was immediately sending to Colorado? John Herrick, the Colorado Independent.
That's Mike Willis. We should be able to inventory those here in the next 24 hours.
Vinny Deljusi also asked about ventilator orders. Patricia Wagoner with Kiowa County Independent. How many healthcare workers have been infected?
This is Scott Bookman. It's a good question. I don't have that information available at this time. We'll look into it.
Okay. Well, I'm not seeing any other questions coming through at this time. And we're right up at 11:29 anyway. So I want to thank you all for joining us today. Before we sign off, I will just have Scott and Mike state their titles and spell their names for you one last time.
Mike Willis, W-I-L-L-I-S, the Director of the Office of Emergency Management.
Scott Bookman, SCOTT-BOOKMAN, and Incident Commander for CDPHE.
Great. Well, thank you everyone for joining us this morning. Have a great day.